of shock because of hemorrhage, how is the status of the fetal heart, whether the baby is alive, whether the baby is dead. So accordingly we classify. So in cases if there is major concealed hemorrhage which is taking place, in that also we can come to know, depending upon that uterus is tense, tender, there will be pain, patient will have severe pain, abdomen, and we don't find her in labor. But yes, because the hemorrhage episode has taken place and probably it is a concealed one, so and the height of the uterus will be more because the blood is accumulating. So there are few features. Now talking about clinical features, symptoms will be abdominal pain. In contrast, placenta previa, that is painless. In this we have got features of abdominal pain. Then vaginal blood is dark colored. In placenta previa it is bright red color because it is just coming from the near site only, but here it is dark color blood. Then we have got features of shock. They are usually, it may be present or may be absent depending upon the grade. Okay, and there can be urine output may also be less. So these are few features which we may find. Usually these features are not present. It is in placenta previa it is quite better condition as compared. So pallor depending upon the blood loss, and we may find features of preeclampsia, that is blood pressure may be high, and pedal edema and edema on the other parts of the body as well. So these are important features of preeclampsia. Then on per abdomen examination we look for the uterine height, the fundal height. It may be corresponding to the period of gestation in a revealed variety, but the fundal height may be more in the case of concealed variety because blood is also accumulating there. So we look for the fetal parts. Usually they should be palpable, but if the blood is accumulating, the uterus is become tense, tender. Depending upon how much hemorrhage is taking place, we may not able to appreciate fetal parts many a times because everything is tense around. We could not find where is the feet and where is the part. Then fetal heart, if it is a mild case, fetal heart, the fetus is alive and it is good fetal heart and we recover that baby. But if the episode of abruption was a major one, many a times there is intrauterine death and fetal heart may not be auscultated. So what all investigations you are going to send? You are going to send the blood investigations, hemoglobin, blood grouping. You have to arrange the blood, you have to keep in store the blood if and when needed, and any investigation for preeclampsia if it is associated, urine albumin, liver function test, kidney function test. Then coagulation profile in the form of bleeding time, clotting time because hemorrhage is taking place, PT INR, that is prothrombin time, and INR and APTT. So these are few blood investigations which we need to order. Now talking about the complications. In complications you have got maternal complications and fetal complications. In maternal complications they can occur during pregnancy, that is antenatal period, intrapartum, that is during labor, or postpartum. So hemorrhage is occurring place. So because of hemorrhage it can lead to shock, which can be during antenatal period or it can be during just at the time of first stage of labor or with the delivery of the baby. So bleeding can be at any time. Similarly, depending upon the blood loss, the process of hemorrhage, patient can have blood coagulation disorders. Because patient is going into shock, she may have oliguria, anuria, that is less urine output or no urine output because of acute renal failure. Then post delivery she may have PPH because of the reason can be atonic PPH also in her case, or coagulation disorders. Then because of interventions and poor nutritional status, she may lead up into sepsis, and there can be recurrence in next pregnancy. So these are the maternal complications. And Sheehan syndrome, that is one, that is postpartum pituitary necrosis, because we know that bleeding has occurred, so the other vessels of the body which are in brain and other major organs, they are in a state of spasm. So what will happen in brain, in pituitary, at the level of pituitary, because of the spasm of the vessel, what is happening? There is necrosis of the pituitary, and pituitary is an important organ which is involved in lactation. So such kind of patients who had an episode of massive bleeding and there is necrosis of the pituitary, there may be necrosis of the pituitary and can result into lactation failure. This is called as Sheehan syndrome. Talking about the fetal complications, yes, because of prematurity, there are complications of prematurity. Low birth weight may be associated. Intrauterine growth restriction may lead to intrauterine death. So the complications of fetal are mostly same as that of placenta previa. So if you know the topic, if you know the concept, then you can definitely enumerate the complications by your knowledge as well. So go through it, and if any doubts, do come back with your doubts. Thank you.